So if you've seen my previous video, you know that recently I failed my OSCEs, and this was probably one of the most difficult periods of my life. But moving on from then, there was something that I really wanted to work on, and I think failing my OSCEs really made me realize that this was something that I believe will really be helpful for a lot of students. So I've made this app called Dr. Prepper. Basically, this is how the app looks. You sort of scroll through it. It's meant to have every specialty that you would see in like med school exams, particularly in the UK and Australia. But soon going forward, I'd like to expand to have some cases for like the US exams. But for now, we're starting with my country right now, the UK. So what is this app for? I wanted an app that bridges past med and OSCEs. So let's say SBA revision with OSCEs, and I really believe that this is what this app can be. Right now, there's only 10 cases for each specialty, but this took me weeks to make. I'm working on a newer version, but I'd really appreciate it if you guys could check out this app, if you could add your emails, which will let me to email you when the new version of the app, or like the website rather, is ready. And while you're there, I'd also really encourage you to please leave feedback. Everything that you let me know, as soon as you tell me, I'll be able to implement it straight away, as I'm still working on the more polished V2 of this app. So why am I making this app again? The app will allow you to work through clinical cases. Oftentimes in medical school, in my third year of medical school, we had something called problem-based learning, and this allowed us to work in small groups with like 10 of us and a tutor, and we'd work through an actual case from start to finish and try not to kill the patient. And I really found this helpful for my learning and knowing what to choose on each point, knowing why we're choosing this investigation over this one, why we have this as our differentials over this, and why we have this as the potential management plan. In the later clinical years of 4th and 5th year of medical school, we had a lot less of this, and it was really just down to your placements provider to really give you that sort of teaching. But some placements had really good teaching, some had a clinical teaching fellow, but some didn't. That really made your revision and your learning skewed. Unless you're going to ward rounds every day, which of course can be quite boring. Well done if you did, but unless you went to ward rounds every day, it'd be hard for you to even know how a case is worked through. And even while you're there, you may not really know what's been going on that ward round. It may be left for the nice doctors there to fill you in on what has happened so far, which would help you to aid your understanding. But with this app, hopefully this should be as a tool to revise. So when you're revising your core conditions and you're going through your differentials, your investigations, your managements, this app will allow you to hopefully put all of that knowledge into practice before you go and start practicing for OSCEs, or even as well as you do OSCEs. It's like meant to be sort of like a bridge. So by using this app, it'll allow you to see the conditions that you're studying in context with a real patient. You'll have a real presenting complaint, you'll have a real history of presenting complaints, you'll have a past medical history if that's relevant, drug history, family history. So this case assumes that you've already taken your history and you have all of this information, and it's just left for you to read through it and then to come up with your differential diagnosis, your top three investigations, and your top 3 key pieces of a management. And after that, it will follow on to let you know what the real answers are for each of those cases. And then from there, you can move on to reading the section at the bottom of the sheet, which will give you some more information for that case. But again, this won't be ready in the app that I'm showing you now, but it's something I'm working on for the new app. If you like this app, please support it. Please, follow me on LinkedIn. That's where I've posted it. I'm very active on LinkedIn. It's just my name, Charles Onzrike. And as well as that, I'm also going to be making some like social media for this app as well, on like Instagram and things like that. So I'm going to be posting on Instagram. If this is what you want, then please let me know. And going forward, we'll also make some more videos, maybe even have a separate channel for the Dr. Prepper app. But we'll see how far this can really go. But at this point in time, I just really need your support. I'll link the app down below, so please follow it. So please click onto it, use it, give me feedback, add your email. I can only take up to 100 people so far for this first version of this app. So if this is something that interests you, then please let me know, and I'll see you guys there.